1919 was an auspicious year in history. The First World War ended, ushering a drastic change in the world order. The Philippine Islands had been a U.S. territory for 2 decades and was promised independence under the Jones Law of 1916. Progressive reformers saw the country and its people as a major target for modernization, and education was its main weapon. 7 forward-looking Filipinas came together in 1919 to create a school where young women could gain the knowledge and skills that would make them modern women. Paz Marquez Benitez was the first president of the Philippine Women's College. Jose Abad Santos was its first chairman of the Board of Trustees. Francisca Tirona Benitez was the second president, and with her husband Dean Conrado, guided the school from a house on A. Flores Street to its iconic Taft Avenue campus. In 1932, the college became a university, making PWU the first university for women in Asia founded by Asians. It provided a space where innovations in education flourished, and young people were encouraged to be the best that they could be. For over 100 years, the Philippine Women's University has been known as a leader in quality education. In 1934, PWU moved into its main campus on Taft Avenue, and since the 1970s has been co-educational. Located in the heart of Metro Manila, it is easily accessible by public transport and surrounded by affordable housing. Today's PWU offers undergraduate and graduate courses in several fields of study. Its business and management programs are responsive to the needs of industry, using evolving technology for global competence. PWU graduates excel in arts and sciences, education, social work, and diplomacy. Its fine arts and music programs have produced outstanding graduates through a holistic education that treasures heritage as well as excellence. PWU has pioneered in fields such as food science, nutrition and dietetics, medical technology, pharmacy, and nursing. PWU continues to play an essential role in producing graduates who possess the skills that make them competitive in the country and anywhere in the world.
Good afternoon. We have few reminders before we begin the webinar proper. Make sure that you have a stable internet connection to avoid important topics of the webinar. Please type your question in the comment box for the open forum. Type your name and department to be recognized. You may take down notes that will help you remember key points from the speakers. We would like to know your feedback by filling up the evaluation survey. Hello, a pleasant good afternoon to everyone. I am Nurse Isa Donna Togbo, your Master of Ceremony for this day. Thank you all for taking your time in joining us today. On behalf of Medical Specialists and Diagnostic Center, we welcome you to our first webinar entitled COVID-19 Vaccination, the Pros and Cons. The Philippines COVID-19 vaccination was officially started last March 1 among medical frontliners and other priority groups, such as senior citizen and person with comorbidities in the following weeks. However, there are a lot of people who are still in doubt to get the vaccination due to false information regarding the vaccine. So today, to enlighten us regarding the COVID-19 vaccine, this webinar aims to disseminate the proper information about the COVID-19 vaccine and create awareness of the importance of vaccination as a preventive measure against the spread of COVID-19 infection and its possible complication. Before we start, let's begin this program with a prayer and followed by the national anthem.
doses and more and more. This virus is not SARS, it's not MERS, and it's not influenza. It is a unique virus with unique characteristics. Both COVID-19 and influenza cause respiratory disease and spread the same way, via small droplets of fluid from the nose and mouth of someone who is sick.
A person under observation has tested positive for the novel coronavirus. This is the first case in the country. The patient is currently admitted at a government hospital in Manila. Here's more information from the health secretary himself.
The confirmed case arrived in the Philippines from Wuhan, China, via Hong Kong last January 21, 2020. The patient sought consult and was admitted in one of the country's government hospitals last January 25.
Land, domestic air and domestic sea travel to and from Metro Manila shall be suspended beginning March 15, 2020 and to end on April 14, 2020.
There are 70 possible coronavirus vaccines in development around the world as scientists race to find the ultimate solution to the pandemic. And for now, the Chinese are in the lead. The country has 3 potential vaccines approved for human trials, and one of them has just advanced to phase 2 of those trials.
President Duterte has allowed the Food and Drug Administration to issue an emergency use authorization to manufacturers of potential COVID-19 vaccines and drugs. This will shorten the processing time for the approval of applications from 6 months to just 21 days, according to health officials. In a text message, FDA Director General Eric Domingo says they are very excited about the news and that they will do their best to make safe and effective vaccines available in the country soon.
Kasabay din po ng ECQ ang pagpapabilis ng bakuna sa pamamagitan ng pagsasabay-sabay sa mga healthcare worker, mga senior citizen at mga may comorbidity. Pero isa po sa mga yan ang may kondisyon bago turukan. Saksi, si Sandra Aguinaldo.
Hindi po titigil ang pagbabakuna kahit na tayo po ay nasa ilalim ng ECQ.
Moving right along, I am pleased to welcome our University President, Mr. Marco Alfredo Benitez, to deliver the opening remarks.
Dr. Nini Lim, head of our Vaccine Information Campaign Committee, our distinguished speakers, Dr. Winnie Siao and Dr. Aguedo Troy Gepte, members of the PW community, friends and guests watching on our social media pages, a pleasant day to all of you. I would like to thank the organizers and, more importantly, our speakers for taking the time out of their busy schedules to share with us their perspectives and information about the COVID-19 vaccines. As our country continues to grapple with the current surge in the number of COVID-19 cases, while at the same time exerting all efforts to ramp up on the distribution of vaccines, our health experts believe, and it has been proven by data from other countries, that vaccination, when added to the minimum public health standards, is our best way to get out of this pandemic. Looking at examples around the world, Israel in particular, who have vaccinated over 60% of their population and are now almost back to their pre-pandemic way of life, gives us renewed hope that there is truly a light at the end of the tunnel. As of April 25, the Philippines has already administered more than 1.75 million doses and fully vaccinated roughly 231,000 individuals in its vaccination program that started in March of this year. While the total number may be at par with some of our Asian counterparts, as a percentage of the population, however, we are still far away from achieving herd immunity. With the country expecting vaccine supplies to ramp up in the coming months, despite the global shortage, it is imperative that we are able to vaccinate as many people as possible as the vaccines become available. To do this, we have to make sure that we clearly disseminate not only to our community, but to the broader public the benefits of getting vaccinated, the safety and efficacy of the vaccines that are and will become available, the possible side effects, and manage expectations and the limitations of the vaccines, as well as debunk some of the false information going around with respect to this powerful weapon against the pandemic. According to Father Nicanor Austriaco, the Filipino-American Dominican priest and molecular biologist who has become one of the foremost authorities and sources of information during this pandemic, what is significant about the Philippines is that Filipinos prioritize the health and safety not just of themselves, but their families and the people living around them. Hence, the willingness to adhere to the minimum public health standards such as masks and social distancing in order to protect not just ourselves, but the people we interact with. Vaccine hesitancy among Filipinos is not ideological, but rather a function of concerns about safety and efficacy. Thus, with a proper information campaign, with evidence of people they know getting vaccinated, and with proof that it does indeed lower the risk of severe infection, hospitalization, and death, then Filipinos will more than likely be more convinced to get vaccinated themselves. Today, through our guest speakers, we hope to be able to address some of the more pressing questions about the importance of vaccines, their safety, efficacy, and limitations, as well as how they can contribute to the overall effort to get out of this pandemic and revive the economy so that we can return to some semblance of normalcy. Feel free to share this webinar to your friends and family. As an institution of faith and founded on values such as leadership and community participation, we hope to contribute our part in the fight against this global health crisis. Thank you very much and good day to all of you.
Thank you, President Marco Benitez, for those wonderful and inspiring remarks. It is a pleasure to introduce our first speaker, who is going to talk about COVID-19 vaccination, things that we would like to know. May we also give a heads-up reminder to our Facebook viewers that you may type in your question via comment box. These questions will be read after the presentation. Dr. Winnie Siao graduated Doctor of Medicine from the University of Santo Tomas. He got his Master of Public Health at Mahidol University in Bangkok, Thailand, under the scholarship of Southeast Asian Minister of Education Organization. He was a past president and fellow of the Philippine Academy of Family Physicians. He had been a former consultant and faculty at the University of the Philippines Department of Family Medicine. He was also a former faculty at the University of Santo Tomas Department of Preventive and Community Medicine. He is the present Dean of the University of Perpetual Health Laguna College of Medicine. Ladies and gentlemen, let us all welcome Dr. Winnie Siao.
Okay na? Am I okay? Good afternoon, everyone. Good afternoon.
Yes, Dr. Siao, we hear you.
There is something, thank you very much for that introduction. But there is one thing that is lacking in the introduction, because my connection with JASMS was not mentioned. I am the school physician of JASMS, Quezon City. And since this is the first time, of course, that I have seen the President, good afternoon, sir. And our chair for the vaccination campaign, Dr. Nini Lim, good afternoon, ma'am. And to the rest of the VIP population of PWU. I understand, of course, that some of the members in the audience are actually guests. Because earlier, after we attended the Mass, I was talking to the Dean of Medical Technology in Perpetual Health, and she was saying that she's going to attend. And that made me even more conscious about the size of the audience. Anyway, for today, we are going to tackle COVID-19 vaccines, things that we should know, and zero in on the adverse reactions. I hope that everyone is willing to be vaccinated when your time comes, because we need it. We need everyone to be vaccinated. We should, am I coming in clear?
Yes, clear po, Dr. Siao.
Okay. We should remember, of course, that there are 4 pillars of the COVID-19 pandemic response. One is the contagion control, and this consists of our own personal hygiene. The second will be your early home treatment in terms of the secondary level of prevention. The third will be your late stage treatment in hospitals, particularly for the most vulnerable population. And for today, we are going to spend our time talking about vaccination, and the purpose, of course, is to attain herd immunity. For purposes of definition, and for everyone to understand and encourage, as the President was saying, to correct the hesitancy and embrace, of course, the purpose of the vaccination to attain herd immunity. The government had envisioned that we are going to vaccinate at least 70% of the total population. If we are 110 million Filipinos, dapat 70% of that should be vaccinated in order to attain herd immunity. Herd immunity means a big percentage of the general population had been vaccinated and therefore will have a certain degree of immunity. So that since the coronavirus will be staying with us for quite some time or long, that at least 70% of the population, which consists of the herd immunity, are vaccinated already and therefore have that sense of immunity. As a result, of course, hindi na maapektuhan yung iba. And therefore, hindi na kakalat yung coronavirus. Okay? That is the purpose of the herd immunity. Congratulations, of course, simply because the frontliners in basic education and the higher education institutions have been elevated in terms of prioritization or the priority population group. It used to be under priority B. However, the IATF had elevated it na ngayon frontliners in the education system had been classified as A4.11. So malapit na. Nasa ano na tayo, nasa A3 na ba? Kasi yung mga comorbidities. So malapit na we're near wherein all teachers must be vaccinated. Okay. So we have to take a closer look on certain facts about the COVID-19 vaccine. Fact number 1, when you are vaccinated, you are not going to have COVID-19 disease. It does not mean that pag nabakunahan ka, magkakaroon ka. No, it is not. The COVID-19 vaccine does not contain any part of the COVID-19 virus to stimulate you from having an active disease. Okay. Fact number 2, the virus has been on a quick development phase, but it is safe. If you will compare the COVID-19 vaccine with the other, like polio vaccine, it took so long. But technology, of course, had shortened that particular period of discovering vaccine. Everyone is on phase, every vaccine are on phase 3 already. Okay. Fact number 3, a COVID-19 vaccine may provide protection against more than one strain. More than one. Doesn't necessarily mean that all vaccines, all mutants, all mutations will be covered by the vaccine. As a matter of fact, Pfizer said we probably need a 3rd booster shot. Fact number 4, a COVID vaccine will not change our chromosomal constituents in terms of our DNA. It will not change our own DNA. Fact number 5, COVID-19 vaccine has not been linked to infertility or miscarriages.
Dr. Siao, please transfer your slides. You move your slides, please.
How can I move this? I need help. I need assistance. But don't worry, if you belong on this group, you can still get your vaccination. Okay, who should be evaluated before the vaccination? Because it's a normal phase. You register, then there's a counter there for orientation, there's a counter there for screening. If you are fit or not fit, who should be evaluated before the vaccination? Anyone who has immediate allergic reaction to any other vaccines, like flu vaccines, and injected medicines such as antibiotics. Then you should be referred to an allergologist for further evaluation. Just as disclaimer. The slides will be shown here are actually coming from the Philippine Society of Asthma, Allergy, and Immunology, and their website, and our webinar that we have attended. Okay. Who should not be given the COVID-19 vaccine? Persons who develop immediate allergic reaction to the first dose of COVID-19 vaccine. Remember, the first dose of the COVID-19 vaccine. Pag nag-react ka doon, pag nagkaroon ka ng allergic reaction there, then it is doubtful whether you're going to have your second dose. And persons of allergic reaction to COVID-19 vaccine components, such as yung sa Pfizer or the Moderna, which we call the polyethylene glycol. It's a component of the vaccine. Okay. After you have received your vaccine, patients must be observed for at least 30 minutes after vaccination. It's a brief respite, so to speak, after the injection, because you will be observed in terms of, are you going to develop rashes? Are you going to have your blood pressure rise? Are you going to have your fever, things like this? That's why you need 30 minutes of being observed. Initially, when I was screened for my AstraZeneca shot, my blood pressure, which I couldn't explain, rose up to 140. Na hindi naman nagpo 140 ang aking BP. They were saying, are you anxious? Of course I'm not anxious. I'm waiting for this. But after this shot, and I was observed at the more intensive room for observation, I was hooked to a monitor, but the blood pressure was normal, 120, 114 even. 120 was my normal. Okay. Let us take a closer look on the allergy risk assessment of COVID-19 vaccination. Do you belong to the low risk? For those people with no history of allergic diseases or previous severe general reactions, then by all means, go and have your COVID-19 vaccine. Those with allergic reaction of any severity to food, inhalant, environmental allergens, insect bites, latex, oral medications, not related to vaccine and their components such as the polyethylene glycol, go and get your vaccination shot. Those with well-controlled asthma or inhaled corticosteroids, and those with allergic rhinitis, go and get your vaccination shot. Walang problem doon. Let's go to the moderate risk. How many of you are on the moderate risk? I'm sure these are much lower in number than the low risk. You are in the moderate risk if you are with immunodeficiency or autoimmune disease, such as Bell's palsy, or taking any medications. May receive COVID-19 vaccine still with proper advice about limited data on vaccine safety. Those with uncontrolled asthma may still receive COVID-19 vaccine in a more appropriate setting, such as hospital. Those with an immediate allergic reaction that is expected within 4 hours, such as urticaria or pangangati, angioedema or yung swell yung face, difficulty of breathing regardless of severity, you will be referred to an allergologist. I'm sure not of you, because you are physically, mentally healthy, you are not on the high risk. Those with an immediate allergic reaction that is within 4 hours, whether mild or rashes or severe, or anaphylaxis of COVID-19 vaccine after the first dose. Anaphylaxis is defined as the severe form of allergy, wherein you have difficulty of breathing, uncontrolled, you may have wheezing in the lungs, etc. You should be hospitalized by then and be given proper medication. Dose-anal allergic reaction to the component of the vaccine, medyo at high risk yun, and should not receive COVID-19 without proper referral to an allergologist in terms of knowing how to approach this particular reaction. Okay. Diagnosis and management of severe allergic reactions after COVID-19 vaccination. For example, you got the shot today. After 30 minutes of observation, you develop pruritus or pangangati, flushing or redness, and of course, facial angioedema or pamamaga. Usually, of course, sa ilalim ng mata. All you have to be given is antihistamines or the anti-allergies. Or you can be given mild steroids, such as dexamethasone. Then observation for a long period of time. And if it does not prevail, and if it will not continue, discharge the patient. Okay? It's here. However, if patients develop the following symptoms, such as shortness of breath, wheezing as in asthma, syncope or hinihimatay, blood pressure drop, you are to be observed and will be given epinephrine, which is, of course, very potent to remove all those symptoms. Okay. Let us continue. If na-resolve na, if your symptoms have been resolved, discharge the patient. If not resolved, you are going to be admitted more because for emergency assistance. Blood pressure drops, of course, nandun na yung IV fluids or suero, no improvement in 5 or 10 minutes, repeat the epinephrine. For bronchospasm, for asthma, then you take your anti-asthmatics like salbutamols. And if symptoms are resolved, discharge after 24 hours. Okay. And of course, take note that adverse reactions may be observed and be referred to an allergologist. Let's go to the side effects of COVID-19 vaccination. Una, ang COVID-19 ay maaring magdulot ng lubhang sakit at nakamatay. And we have read this in all the dailies. Ang pagbabakuna laban dito ay magbibigay ng protection at maaring maging solusyon sa pandemic na ito. And if you have, after vaccination, and if you have, of course, magkaroon ka man ng COVID, it will save your life because it will be very mild reaction. Third, Hindi lahat ng reaction sa bakuna ay allergy. Karamihan sa mga reactions ito ay banayad lamang. Ang panganib ng anaphylaxis o malubhang allergic reaction ay napakadalang sa mga nabakunahan. Ang mga taong may asthma, allergic rhinitis, allergy sa pagkain, drugs, insect bites, ay walang kaugnayan sa vaccine na pwede nating sabihin na maaari silang mabakunahan. Sa ngayon, ipinagbabawal ang pagbabakuna ng COVID-19 sa isang individual na nagkaroon ng allergic reaction sa unang turok ng COVID-19 vaccine o sa anumang sangkap nito like the polyethylene glycol. Again. Remember, of course, na nakakahigit ang benepisyo na mabigyan ng protection sa pamamagitan ng bakuna kaysa sa panganib na maaaring idulot ng sakit na COVID-19. It will surely prevent death among those who have been vaccinated. One particular thing that we should know is, halimbawa, nagka-COVID ka ngayon and you are discharged from the hospital because you have satisfied the period of quarantine, pwede ka na agad mabakunahan. You don't have to wait for 90 days to receive your vaccination. Immediately, even after discharge from the hospital or after completion of the quarantine period, you can be given the vaccine already. Okay. Again, help yourself, help others, help your family, help the country in terms of subject yourself to vaccination. Because you will be heroes or heroines in this era of pandemic in order to raise the level of herd immunity. Yung dalawa pa rin ang available. Sinovac, of course, the data of Sinovac is actually from 15 to 59 years old. So senior citizens like me are not included in the data provided by the Sinovac. So I do not have much option but yung AstraZeneca. I'm sure you have heard about incidents in UK about the possibility of blood clots associated with AstraZeneca. Further studies have shown na hindi related yung blood clots against the AstraZeneca vaccine. So I feel safer. Dapat ang safe actually yung Sinovac kasi old formula ito yung inactivated virus, dead virus na in-inject to stimulate an immune response. Kaya lang their data is insufficient for senior citizens. So young people like you guys are walang problem. You can take both Sinovac or the AstraZeneca. They were saying this is not documented. The messenger RNA, for Pfizer, ang sinasabi nila is that when it is injected, unlimited yung pag-produce ng proteins necessary to stimulate the formation of antibody. So, they fear na baka daw mas marami ang allergic reaction. But Pfizer, of course, denied that na hindi. As a matter of fact, some friends in US, actually, they were given Pfizer because it is the one available to them.
Okay, Dr. Siao. Thank you po. So the next question is, what vaccine most fit for senior citizens with comorbidities like diabetes and those who are undergoing dialysis po?
Actually, so if you talk about data, the availability of data, AstraZeneca has more substantial data to show to us that it is safe. As I was saying, the Sinovac actually until 59 years old lang yung data nila. Although sinasabi, like on extreme cases na wala talaga, then you can be given the Sinovac, pero you should be oriented on the limitation or none at all availability of the data. What they have sufficient, and you can be safe if you are 59 years old younger.
Okay. So the next question is, with regards to the additional booster being proposed by Pfizer after the 2 shots, will there be an instant in the future that all vaccines will require new shots to cover all mutating virus?
That is a great possibility. That is a great possibility considering about the fast mutation of the variants. Because not all vaccines are effective on all variants. So baka kailangan talaga ang booster in order to address the new variants.
Okay. And
Mabilis yung mutation.
yes, opo. And the next question is, how long is the effectiveness of vaccine? And do we need to be vaccinated yearly?
The vaccine, the effectivity, or in other words, the degree of antibody is not forever in this type of vaccines. They were saying that until 90, from 6 months to 8 months. It's not even a year. Then the need for another vaccination may be a probability. That is the reason why herd immunity is being encouraged. Kasi para nga matigil yung mutation, para to stop the variants from becoming more mutated, and therefore padami ng padami, so that as one speaker said, like si Dr. Castillo was saying, baka yung ating vaccine ngayon hindi na relevant 2 months after. Because the variants na ang mag-ano to. Remember that our vaccine has been formulated for the mother coronavirus. But it has undergone various degrees of mutation, so that ang fear natin ngayon, like even the SARS now, must have been with the new variants.
Okay. So, Dr. Siao, last question.
Okay.
How safe is a person obtaining her second dose vaccine? Does it ensure the individual to be safe from the virus?
The question is how safe for an individual who had received
Yes.
the coronavirus second dose.
Yes.
Wala siyang allergy dun sa first dose.
I think so if he
You know,
do the second dose.
Yes. Actually, you are safer. You are much safer after receiving the second dose. But again, it's not immediate again, ha? They were saying even na after 2 weeks ka pa, tataas talaga yung iyong antibody. And that is the measurement of effectivity. Kung tumaas na yung iyong antibody. So, you're safe with that.
Yes. So I'm safe now. I got my second dose.
You had.
Thank you. Sinovac, Dr. Siao.
Oh, yeah, that's good. You're young, though, so that's why, you guys are young, so Sinovac advisable for you?
You're still young, Dr. Siao. You look young.
You have nice thoughts.
Okay po. Thank you again, Dr. Siao, for answering and sharing us with
Thank
this
you very
afternoon.
much for the opportunities.
Okay. May I
bye-bye.
now, okay po. Thank you. May I now call Dr. Ramonel Tolentino to award the Certificate of Appreciation to Dr. Siao.
The Philippine Women's University, Avenue, Manila, in cooperation with the Medical Specialist and Diagnostic Center, present this Certificate of Appreciation to Dr. Winnie Siao for sharing his knowledge and expertise as a resource speaker on the topic COVID-19 vaccination, things that we would like to know. For the program COVID-19 vaccination, the pros and cons. On April 29, 2021 at 1 to 4 p.m. via Google Meet and Facebook Live. Given this 29th of April 2021, signed by Dr. Nini Lim, Executive Director, MSDC, and Mr. Marco Alfredo MBDS, University President.
Thank you. Thank you very much.
Congratulations and thank you, Dr. Siao.
Thank you. Okay, may I leave now?
Okay. May I now introduce our next speaker, who is going to talk about the status of COVID-19 vaccination in the Philippines. Dr. Aguedo Troy Gepte graduated from the intermed program of the UP College of Medicine. He got his Master of Public Health degree from the Institute for Community and Family Health Incorporated of the Fidel Mundo Human Resource Development Center for Health. He started his public health career at the Research Institute for Tropical Medicine. He became the training officer of the Field Epidemiology Training Program of the Department of Health. He had been a faculty at the Ateneo Loyola Schools for the Health Sciences Program, School of Government Master of Public Management course, as well as School of Medicine and Public Health. He was also a former faculty at the University of the Philippines College of Medicine. He is presently teaching at the New Era University College of Medicine and the Philippine Women's University. Dr. Gepte was a consultant to the DOH Office of the Assistant Secretary under the Health Policy and Systems Development Team, and has been a consultant for the Senate Committee on Health and Demography, previously under Senator J.D. Ejercito and now under Senator Bongo. He once worked as a consultant for the Philippine World Health Organization Country Office on emerging infectious diseases such as SARS, avian influenza, MERS, and Ebola. Dr. Gepte is now back again at the World Health Organization Country Office to help in the COVID-19 outbreak response. Ladies and gentlemen, let us all welcome Dr. Aguedo Troy Gepte.
Good afternoon, everyone. This is Dr. Troy Gepte. This is our talk for the status of COVID-19 vaccination in the Philippines. I'd like to start with what's happening now all over the world regarding COVID-19. We have at least 148,329,348 confirmed cases of COVID-19. This includes 3,128,962 deaths as reported to WHO as of 28 April 2021. As of 27 April 2021, we have a total of 983,111,706 vaccine doses that have been administered in different countries in the world. So this is almost 1 billion vaccine doses as of 27 April. WHO is broken down into 6 regions all over the world, and in this part of the world, the Western Pacific region, Actually, the Philippines is leading in terms of the number of confirmed cases at 1,013,618. Japan is second, and followed by Malaysia, Korea, China, and the other countries. On the center, you can see that the Philippines is really having a large part of the number of confirmed cases relative to the other countries. On your right, we have the tally, and we also have the cumulative confirmed cases in that epic curve. As you see from the start of the pandemic in 2020, now it's really rising to um, just to what seems to be a peak greater than what we experienced from the past in July and August of last year, and even in early 2021. So for the Philippines, we actually have 1,020,495 cases as of 28 April. This includes almost 70,000 active cases at the moment, and most of these are mild cases at 64,334. Recovered is at 935,695, which accounts for around 90+% of all confirmed cases. Unfortunately, we have had 17,031 deaths. Below is you can see that we have distribution by age group and sex, where we have the most mobile age group, the 20 to 29 and 30 to 39-year age group, as having the most confirmed cases. Males slightly outweigh the number of females, or the percentage of females. And in terms of the comorbidities, we have allergic rhinitis, chronic kidney disease, I think, and pneumonia as the top three. For those that lead to comorbidity deaths, we have chronic kidney disease, pneumonia, yeah. And for all regions, NCR, Calabarzon, and Central Luzon are the most affected regions. In terms of the most number of confirmed cases, NCR has the most number of cases, with almost 500,000. This is followed by Calabarzon, Central Luzon, Central Visayas, and then Western Visayas. But in the last 14 days, the ranking is a bit different, with Cagayan Valley in the top 4 in terms of the most number of cases in the last 14 days. For the top provinces and cities, we have Quezon City with the most number of confirmed cases ever since the start of the pandemic, and then this is followed by City of Manila, Cavite Province, Rizal Province, and then Laguna. For the last 14 days, it's a similar trend, where we have Quezon City leading in terms of the most number of cases, and then followed by Cavite, Rizal, Bulacan, and City of Manila. You can see in this epidemic curve that the number of cases since around early March to the present, it has really far exceeded what we had during the peak of the pandemic in July and August of 2020. So this phenomenon is not just unique to the Philippines, but we can also see this in other countries in Asia and most part of the world. And then looking at the laboratory positivity rate, we have around 16.6% positivity rate at the present. It has gone down from around 25%, and this is for nationwide. WHO recommends two indicators. One is for us to determine whether we have the appropriate number of tests that is being conducted. Supposed to be we should have at least one test per 1,000 population that's being done, and there's quite a range from different regions in the Philippines. For NCR and for most of these regions that we have mentioned, the testing is mostly more than one test per 1,000 population. But for some regions in the Visayas and Mindanao, it still is much to be desired to really come up to that kind of standard. Another one is if we have positivity at around 5%, that will indicate that we have good enough testing. So we're still far way off as we are still presently in the middle of this big surge in the number of cases. In terms of the number of tests that are being done, it has so far increased as we have responded to this great number of cases that has happened since early March. In terms of the occupancy of the number of beds, to mention the total number of beds, it's at 50% almost at for our country. And for ICU beds, it's around 63.2%, with isolation beds around 40 plus percent, so with ward beds. And for mechanical ventilators, it's around 30 to 40%. What we're trying to look at now is the healthcare utilization rate, specifically in regions like in NCR and the adjoining regions of Calabarzon and Central Zone, where we continue to have a greater number of admissions. And I think, as you know, there's really a lot of efforts that is being done by the government to augment the number of beds at the moment. So we are still trying to bring down this occupancy rate so that we can try to manage as much patients as possible in our facilities. So let's go to the main topic for our talk. What are vaccines for? Vaccines really are for us to be able to raise the immunity of people to fight off the disease. It says here that vaccination or the vaccinee does not injure the illness in the normal course of getting infected with some viral disease or bacterial disease. For vaccination, we need to take note also that there's low risk of adverse reaction, and this greatly outweighs the risk of complications by natural infection. I know you remember this from our lectures and classes in immunology. The father of modern immunology is Edward Jenner. His work on the smallpox vaccine is claimed to have saved more lives than the work of any other human, as the kind of technology that he pioneered in the 18th century is still being used up to today with the current campaign for the vaccination against COVID-19. For vaccine basics, we have really the entry of the virus into the body through the lock and key mechanism, where we have the key or the spike protein it's able to enter the cell through the ACE2 receptor. Once it comes inside the cell, the virus can try to fuse with the vesicle, and its RNA is released. And then the viral RNA is translated into proteins. And yes, this is released outside the cell, and with the vaccination, we try to find a way for these antigen presenting cells to engulf the virus and display portions of it to the T cell, and somehow it triggers the B cell to make the anti-coronavirus antibody. The T helper cell also helps the cytotoxic T cell to destroy the infected cells. So if we have the vaccination, we hope that we can have long-lived memory B and T cells that recognize the virus for months or for years, thus rendering the body to be immune against COVID-19. On the other hand, we also try to look at the public health side of the vaccination, where we have community protection. Um, if we have poor vaccine coverage, there will likely be an outbreak, as manifested by those that are in red, because they transmit the virus to many other people, especially those that are in brown who are susceptible. But if we have more of those who are in blue, those who are vaccinated or protected through good vaccine coverage, we can limit the numbers of susceptibles that can be infected, and we can really contain the infection. For the Philippine National Deployment and Vaccination Plan, um, we have we're drawing this from the National Action Plan Against COVID-19, or the NAP or NAP. It's the National Strategic Plan for the response for the COVID-19 pandemic, and it utilizes the PDITR strategy. PDITR uh, is an acronym for prevent, detect, isolate, treat, and reintegrate. And on the last column is M for mainstreaming towards the new normal. P for prevention is really focusing on important messages for us to be able to do the non-pharmaceutical interventions, especially where we have community lockdown down at the bottom as the last resort. But we should be mindful of hygiene, social distancing, wearing of mask, yeah, and also the face shields. For D for detect, we have aggressive contact tracing, expanded community testing as a means for us to know who among us are infected. And once we know who the confirmed cases are, we try to isolate them appropriately in the treatment uh, and monitoring facilities. And then we also try to look at the close contacts and let them be admitted as much as possible to the quarantine facilities, the TTMFs, the temporary treatment monitoring facilities. For those that will offer home care, we advise actually that um, those who might be infected or turn out to be positive for COVID-19, they should have their own separate rooms for their own access to their own toilet, so that we can limit the transmission inside the household, and that people should wear masks. Right now, because of the surge, many doctors are already advising um, isolation for mild and asymptomatic cases in the household. For T treatment, we have the one hospital command that handles the referral of patients to the appropriate level of hospital care, whether it's at specialty centers or level 3 hospitals, or in level 1 or level 2 hospitals for the milder forms or stages of COVID-19. We also have this mega temporary treatment and monitoring facilities, and these are like those in the PICC, the Ninoy Aquino Stadium, and other larger facilities where they can hold a lot of confirmed cases and close contacts as well. Yeah, and then for R, it's for reintegration, where we try to implement and sustain the minimum health standards and to increase the awareness for possible reinfection. For the NAP phase 1, this started in March up to June 2020, and it focused on preventing and containing the pandemic while mitigating the socioeconomic impact. For the phase 2, from July to September 2020, it focused mostly on the socioeconomic recovery. And from October to March 2021, it has focused on the health risks, management of the health risks, while gradually transitioning to full socioeconomic recovery. And very important is that we are including the vaccines as part of the COVID-19 interventions. For the latest update that I was able to access, as of 24 April 2021, we have had 1,753,465 doses that have been administered in the country. For those that have at least one dose, it's 1,522,696. So this is from the National COVID-19 Vaccination Operation Center, or N, NVOC, of the National Task Force. Most of these doses are for the priority group A1, which are the workers in the frontline health services. Priority group A2 are the senior citizens, and group A3 are individuals with comorbidity. So we have had at least 230,769 second doses for the health workers, but none yet for the senior citizens and those with comorbidities. So in our vaccine cluster organizational structure, the authority to implement the program stems from Secretary Duque being the chairman of the Interagency Task Force on the Management of Emerging Diseases, as well as Secretary Delphine N. Lorenzana of the Department of National Defense, who's the chair of the National Task Force against COVID-19. Between the two, the Interagency Task Force is the policy-making body, while the National Task Force is really the implementing arm, or the operations arm for our response. This is led by Secretary Carlito Galvez, the National Incident Command. Secretary Carlito Galvez, by the way, is also the National COVID-19 Vaccine Cluster czar. Before the pandemic, Secretary Galvez was the secretary for or presidential advisor for the peace process. He heads now a big organization for the response and the recovery cluster. The response cluster is in charge of prevention, contact tracing, testing, isolation, quarantine, treatment, resource management and logistics, and management of returning overseas Filipinos, while the recovery cluster is under the NEDA, the National Economic and Development Authority, which is in charge of health recovery, social recovery, governance, food security, and transport and support for local travel. So our Vaccine Operations Center, chaired by the DOH and co-chaired by the DILG, and it has for its components planning, campaign management and technical team, the cold chain and logistics team, which handles the transport and the supply chain for the vaccines and the ancillaries that are needed, like cold storage boxes, also the syringes and needles that are needed. We also have a coordination team a vaccine safety, surveillance, and response team, and a communications, advocacy, and partnership team. So this is the operations center, but they have a very close relationship with the city health office or the municipal health office, which have their own implementing and reporting units. Whether these are in the government hospitals, private hospitals and clinics, sectors, and government agencies, and the rural health unit or the health centers. For our vaccine operation center timeline, we had a long preparatory period or a pre-implementation phase, followed by the campaign period where we are right now. We have a rolling immunization campaign. So it has a 21 to 28 day interval between round one and round two of the vaccination campaign. And then we have a post-campaign period where we also try to look at the situation to monitor the coverage of the vaccination. So we are doing this all in different parts of the country. So as a rolling immunization campaign, we try to implement it as in various stages where we can work with the LGUs and then try to roll it out LGU by LGU. This slide represents the target population for COVID-19 vaccination. We have projected the population for 2021 in the next 2 years. For this year, 2021, we are targeting 60% of the population, which corresponds to around 70 million. And for 2022, we're looking at the 42 million of those who are 16 years old and below who might already be eligible for vaccination, depending on the studies that are coming out from the medical research and the pharmaceutical industry. And then by 2023, we hope to target the remaining 2 million if newborns will be deemed as necessary to be vaccinated, depending on the scientific evidence and the policy that we'll be setting in the years to come. For funding for the vaccines, this is from unprogrammed funds in our General Appropriations Act, and this corresponds to 70 billion. From our 2021 GAA, we have 2 points. Then we look at older adults because of their age and also those with comorbidities. Then we try to look at other government agencies and their personnel that provide essential services. And then we look at the government workers, teachers, and students, essential workforce, and all other workforce. So we have certain other principles like to also have reciprocity, equal respect, and national equity. So we need to bear in mind that we need to protect as many people as possible, but we also need to look at the nuances or the uniqueness of those that might need to be prioritized. So we have this following priority groups. We have the frontline healthcare workers, then the senior citizens, and then we have the indigent population. We have the uniformed personnel, and then for priority eligible group B, we have teachers and school workers, all government workers, essential workers, and later on other social demographic groups as identified here. And then we have eligible students. Then I think the OFWs have been bumped up because of the risk for them in the other countries. So I think they have been reprioritized to the A group. And then we have the other remaining workforce and the remaining Filipino citizens who will ultimately benefit once we have more vaccines coming in later this year. The vaccine deployment strategy is a phased approach, and it really depends on the delivery of the vaccines. So it's based on a sexual approach where we have to really look at the healthcare workers and to protect them, to preserve the integrity of our healthcare system so that we can have doctors, nurses, medical technologists, and other healthcare workers who can take care of those who are getting sick. The number of individuals to be vaccinated in a round will depend on the total number of vaccines delivered. And we already are considering the competition of the second dose. Since the delivery of vaccines to the country is in tranches, the deployment of vaccines in specific geographical areas shall be based on the burden of the COVID-19 cases. So we have indicators to tell us where to prioritize what specific regions we should try to aim for so that we can try to bring down the number of cases by providing the protection needed to cut the transmission of COVID-19 virus. So the determination of priority geographical areas through the LGUs by province or by city or municipality will be per region. The burden of COVID-19 cases in the country every month is regularly reviewed to recalibrate the priority areas accordingly. At the outset or at the start of the vaccination, we have actually prioritized NCR and then Region 4A and then Region 3 as the top 3 regions where we need to immediately bring up the herd immunity of people. This is followed by Region 7, which had also a surge of cases earlier this year. In terms of vaccine deployment and service delivery activities, we have really done all these pre-implementation activities or preparation leading to the rollout of the vaccine deployment. So we are now at the vaccine administration and the post-authorization surveillance, specifically looking for any adverse events that might be happening. Adverse events are actually of two kinds. It's either mild or severe. So we have the Department of Health leading the way for the other government agencies and the local government units to look at possible side effects or adverse events from the COVID-19 vaccination. So in terms of the storage facilities, we have some rented warehouses or the RITM that will have this vaccines in storage prior to distribution to the regions or to the rural health units or city health offices and hospitals. And then hopefully all of these will try to keep the temperature within the adequate range as seen here in this slide. For most of our facilities, they can handle up to -20 degrees centigrade. Usually we have Sinovac and AstraZeneca at the 2 to 8 degrees centigrade, which is usually can be implemented in regular refrigeration units or storage units. But for some vaccines, like the Pfizer BioNTech, the mRNA vaccines, they need to have ultra cold storage facilities, and they have been identified by the government, and they're still waiting for their turn once these vaccines will arrive in the Philippines. In terms of the implementation, we are trying to use different ways to mobilize the recipients. Usually we are using the fixed point vaccination strategy where we have the vaccination team awaiting the arrival of those who have been pre-listed, and then they will just go to the vaccination site to get their dose. I think we're also contemplating on doing a house-to-house social mobilization strategy to encourage people to get themselves listed, and just so that they can get to the fixed point vaccination sites. We also have pickup points where they can try to get scheduled transport, so that we can have a more efficient and effective way of vaccinating these people. So some updates on vaccine deployment. I think we already mentioned this, that we're still short of 2 million doses of COVID-19 vaccine doses. And we have at least 1.5 million eligible population that were vaccinated with their first dose. Among the healthcare workers, we have 230,000 plus that have already received their second dose. For priority group 1, A1, it's almost 50-50, with Sinovac having 565,000 plus and almost 500,000 for those that receive AstraZeneca vaccine. For priority group A2, we have 221,000 plus, and for priority group A3, we have 239,000 plus. This table represents the vaccination coverage for the first dose and the second completed dose, depending on the A1. So as expected, NCR leads the way, followed by Region 7, and then I think followed by Region 11. So the major medical facilities are in the urban centers in these three regions. And then we are still trying to catch up for most of the other regions. In terms of the first dose vaccination daily coverage, from day to day, we had a big leap when we were implementing the vaccination in the middle of March. But since then, we've had some moderate success in being able to deploy. This really depends on the availability of the vaccine. So we're still trying to await more vaccine supplies in the coming months. In terms of the coverage, overall for the A2 group or the senior citizens, we have NCR, and then we have Region 12, then followed by Region 4A, and then followed by CAR, and then Region 3. So we still have a lot of catching up to do, so that we can cover as many senior citizens as possible. And not so much really for priority group A3. We just started in a few regions, but not for all. This graph shows the number of reported AFIs to Sinovac per region. So overall, we have a majority of non-serious AFIs compared to very few serious AFIs. These AFIs are all being managed and investigated so that we can see whether the vaccine might have any untoward side effects that might affect the deployment of the vaccine campaign. As of 24 April, we have a total of 3,025,600 doses of vaccines that have arrived. So we have had at least 2,500,000 doses of Sinovac and 525,600 doses of AstraZeneca that have come in. So we're still expecting a lot more doses of vaccines in the coming months. Maybe just a few things to remember as an end to our talk. The pandemic still has a long way to run, and vaccines are really a critical tool in the battle against COVID-19. They are safe and effective vaccines, and these are game changers to the pandemic. And we hope that this can be rolled out safely in a lot of the countries that really don't have much vaccination compared to the more affluent countries. COVID-19 cannot be beaten one country at a time, so we really have to do this all together. The global economy cannot recover if there are inequities or disparities in global coverage. So we really need to try to make the more affluent countries, the more developed countries, also share their vaccines with the developing countries. And safe and effective vaccines alone cannot solve the pandemic. As we know that there are still variants that are happening, and they demonstrate the importance of collective action, that we all try to help each other, remind each other about the protection that we need to do, the prevention, and be able to cooperate in being able to identify those who might be infected by COVID-19 and bring them to the necessary facility or refer them to the hospital for appropriate treatment and management. Yes, thank you everyone, and God bless.
Thank you, Dr. Gepte. We will now have the open forum to be moderated by Ms. Angelica Pacaira.
Thank you, Dr. Troy Gepte, for the amazing presentation this afternoon. And for now, Dr. Gepte will have your answers to your questions. Our first question is, at what rate or the number of population do we ensure the herd immunity?
Please unmute Dr. Gepte.
Can you hear me?
Yes,
Ma'am? Yes, sorry, my internet connection is a little slow today. Could I kindly request if you can ask the question again, ma'am?
Yes, okay po. At what rate or the number of population do we ensure the herd immunity?
Okay, thanks, ma'am. Actually, it really depends, ma'am, on the infectivity of the causative agent. Like for some viral diseases like measles, it really has to be at a high rate, like but from what I learned about COVID-19 and how high we should strive for in terms of the vaccination, I think it's around 70% or it may be more, so that we can have a good coverage. But it really depends on not just the infectivity, but also on our ability to roll out the vaccination. As you know, it's not that easy to deploy the vaccine and actually to really wait for the arrival of these vaccines and to have our different government agencies and local government units be able to encourage the vaccination. So there's a lot of different factors that come into play with regards to trying to achieve that particular target. But I think around 70%, based from what I learned about the initial plans for COVID-19 vaccination. Yes, over to you again, ma'am.
Okay, thank you. Then the next question is, since the COVID vaccine is tested on age population between 18 to 65 years old, is it safe to administer this vaccine to ages 17 and below, and also for the 66 years old and above?
Yes, thank you. That's a good question. It depends really on the kind of vaccine. As far as I know, for I think the two vaccines that we have for Sinovac and AstraZeneca, we can't really give the vaccine to those that are under 16 years old, I think, based on the National Action Plan or the National Vaccine Deployment Plan. We don't have that many studies yet. Research studies or trials are still ongoing for determining the effectiveness of the vaccine, the different COVID vaccines in adolescents and even for younger children. But for the older generation, I think we have already issued some guidance from the part of the DOH or FDA about the safety of the vaccines that will be given. I think Sinovac has already been approved for use among those who are 60 years old and above. Still have to remember about, still trying to remember about the AstraZeneca vaccine. There are some caveats in its administration right now, as I think there was a time that it can be given to those who are senior, but they stopped it for those who are less than 60 years old for a time because of the fear of blood clot adverse events. But I think since then, they have reversed that policy or guideline. So I think they're relatively safe for the senior citizens, except that we just have to maybe follow any kind of guidelines for any specific kind of brand of vaccine. But so far, for those that we have already used, I think both are being successfully used for the senior age group. Yes. Thank you. Next question, ma'am.
So, okay. Do you think it is possible for our country to be completely vaccinated this year? Or if not, how long it will take us to be fully vaccinated in our country?
Yes. It's now like April, and we're almost at the halfway mark for 2021. As of now, I think we're just over 1% of the total population. We're striving for, I think, 73% of the population by 2021. But it really depends on, as I mentioned during the talk, on the availability of the vaccines. Worldwide, we really have a shortage of vaccine supply, vaccine dosages. So we really hope that, according to the National Task Force Chief Implementer, Secretary Galvez, I think he mentioned that by July, there will be more and more vaccines, hopefully including also those that we have ordered for, I think, from the pharmaceuticals like Moderna and Pfizer, BioNTech. But I'm not just trying to become a realist, but maybe just to look at the trends, not just for our country, but worldwide. I think it will really be difficult to achieve our targets for this year. So there will be a lot of catching up to do for 2022 once vaccines might become more available. And just to add, there's this difficulty of how we are trying to address the possibility of having more VOCs or variants of concern, as we are seeing some instances where these variants are emerging and they have an effect on the infectiousness or the transmissibility of the virus, but also on the effect of these variants on the testing. and the vaccine effectiveness. So there's still a lot of science that's being developed because of what's happening. We so far have like around 4 or 5 major variants of concern that we are monitoring because of not just the infectiousness, but also the effect on how it might escape PCR testing, as well as its effect on the effectiveness of the vaccine. Yeah. Yes, ma'am. Over.
Okay po. Then the next po is, since the vaccines are for emergency use only, does it mean that those who are vaccinated are actually part of bigger clinical trial and that the vaccine's chronic effects are not known yet? What are your thoughts about it?
Yes, thanks for this question. Vaccine trials, like other clinical trials, they have to undergo a series of tests from lab to animal testing. And for human testing, we try to begin with the initial phases where we have very limited number of subjects, just to test whether it's safe, just to test whether there's an appropriate dosage for the vaccine. Thereafter, at stage 3, we try to see whether the vaccine will become effective for a greater number of subjects, like thousands of subjects, since it will really take many years before we really come up with a good documentation or research on the final effectiveness. The emergency use authorization is a mechanism used by regulatory authorities, not just here in the Philippines, but also in other countries, to be able to get the benefit of the early research findings on effectiveness and safety from these vaccine trials. So going to phase 4, it really has to undergo the process of product registration, and it takes time to really amass a lot of studies of the vaccine effectiveness as the vaccines become commercially available to not just thousands, but hundreds of thousands to millions of people. So it might be interpreted in a way that we're trying to see whether the vaccines are that have been manufactured and have been deployed and administered to people. We're trying to see whether it's really effective and safe. And it seems like it's also going to be included in the overall portfolio of relatively new. We were able to come up in a record time of less than 6 months. It usually takes at least a year or maybe 2 years to come up with good, effective, and safe vaccines. But we're at that stage where we're really a little desperate now to come up with a way to provide more protection for people. Yeah. Yes. Yes, ma'am.
Yes, well, thank you. And for the last question, is it okay to be vaccinated with 2 different brand of vaccines?
Yes. They're still trying to do studies on this, whether if you got one dose or the first dose from one brand and another one for the second dose. Parang may mga early studies na, but it'll still take some time siguro before we actually know whether we can use parang different vaccines for the first and second dose. Much like the question on whether we can already give the vaccine to children or those who are 16 and below. Parang marami pang research studies ang kailangan magawa. And we hope that by 2022, things will become more clear. Yes. Thank you, po.
Well, that's all. Thank you, Dr. Gepte, for answering this question and having with us this afternoon. And again, thank you for joining us. To those who watch us, thank you for joining the webinar on COVID-19 vaccines. We truly learned about with our two speakers. And now let's back to Ms. Isa.
Okay, and wow, today's webinar is really a hit for we receive a lot of reactions and questions. And of course, this is understandable because of the very important information that has been discussed. Okay, I will now call Dr. Raminette Tolentino, who will now award the Certificate of Appreciation to Dr. Gepte.
The Philippine Women's University Taft Avenue, Manila, in cooperation with the Medical Specialist and Diagnostic Center, present this Certificate of Appreciation to Dr. Aguedo Troy Gepte for sharing his knowledge and expertise as a resource speaker on the topic Status of COVID-19 Vaccination in the Philippines for the program COVID-19 Vaccination, the Pros and Cons on April 29, 2021 at 1 to 4 p.m. via Google Meet and Facebook Live. Given this 29th of April 2021, signed by Dr. Winnie, Executive Director, MSBC, and Mr. Marco Alfredo M. Benitez, University President.
Thank you very much for the certificate, ma'am, and for the opportunity to share with you today on this important topic. Again, thank you po.
Congratulations, and once more, thank you, Dr. Gepte. Thank you. Thank you, Dr. Tolentino. I would like to remind everyone to fill out the evaluation link shown on the screen until April 30, 2021 at 5 p.m. to receive a certificate of attendance. And to give us the synthesis, let us all welcome Ms. Nella Mapi.
Well, good afternoon again to our viewers and to our guests who participated in this webinar. Again, on behalf of the Philippine Women's University, the Medical Specialists and Diagnostic Center, we thank you all for joining us in this webinar. Also, we'd like to thank our University President, Mr. Marco Alfredo Benitez, for giving us a very inspiring opening remarks. Today, we tackled the COVID-19, the pros and cons in vaccination. We had two brilliant doctor speakers for today, Dr. Gepte and Dr. Siao from PWU JASMS QC and Dr. Gepte from the WHO DOH. So this webinar enlightened us and gave us informations and very informative and enlightening information about the COVID-19 vaccination. Because despite of the efforts of the government to push through with the vaccination program, the end users or the public still has a lot of doubts and fears regarding the vaccine, COVID-19 vaccine. Dr. Gepte shared with us a very clear and the most current statistics on COVID-19. So let's have a brief recap of the presentation of Dr. Gepte and Dr. Siao. Dr. Gepte has showed us the present situation of the COVID-19 cases in the world and in the Philippines. So as of April 28, the total COVID-19 cases around the globe or around the world has reached up to 148,329,348, including here more than 3 million deaths. So in the Philippines, we have more than 1 million cases now, including more than 16,000 deaths. And luckily, we have a high number of recoveries, including that to 925,000. And regarding the COVID-19 vaccination, as of April 27, 2021, a total of 983,111,756 vaccines have been administered in different parts of the world. So in the Philippines, as a response to the COVID-19, we have our National Action Plan. In our LGUs, they implement the PDITR, as mentioned by Dr. Gepte, wherein this is to prevent, detect, isolate, quarantine, treat, and phase 3, wherein the focus is to manage the health risk while gradually transitioning to socio-economic recovery. And one major action for this is the COVID-19 vaccination. So, an update for the COVID-19 deployment in the Philippines. As of April 24, a total of more than 1.7 million doses of COVID-19 vaccine was already administered to Filipinos. Either it's your first or second dose. 1.5 million of this goes to the first dose, and 1 million of this went to frontline healthcare workers. So more than 1 million, or the rest of the 1.5 million is completed dose received by Filipinos. So current update for the COVID-19 vaccine, we are now on the group A3 or the priority A3, which includes the people with comorbidities. So with the lecture or the presentation of Dr. Siao that tackles mostly on the issues of what the things that we would like to know on COVID-19 vaccination. So what is a vaccine for? So a vaccine is a biological preparation that is injected to us or that gets into our body to help us acquire immunity against a particular infection. So for COVID-19, we are now having the COVID-19 vaccination. So to help us ease our doubts and fears in the COVID-19 vaccination, because we hear a lot of people doubt about the COVID-19 vaccine, especially when they hear that this certain vaccine is made in China. So to ease that fear and doubts, Dr. Siao emphasized 6 facts that is very true regarding the COVID-19 vaccine. The COVID-19 vaccine, firstly, will not give us the COVID-19 infection itself. So when we get vaccinated with the COVID-19, we will not get the COVID-19 infection from the COVID-19 vaccine that we have. And another common doubts of the COVID-19 vaccine is why the vaccine was made in only more than a year, comparing to the other vaccines like the measles vaccine, polio vaccine, and other vaccines which were made more than 10 years. Well, because of the high technology, because of the brilliant doctors, scientists, engineers, and the progress in medicine that we have now, coming up with a COVID-19 vaccine was made possible with their collaboration. So let us not doubt about the short period of the COVID-19 vaccine, how it was made for just a short time. So again, the COVID-19 vaccine, according to the presentation of Dr. Siao, it protects us against multiple strains of the COVID-19 virus, because today we hear that the virus has mutated. We hear about the UK variant, the Brazilian variant, the Philippine variant, and many more. And that COVID-19 can cover multiple strains. So it is one benefit of the COVID-19 vaccine. We are covered for not just one variant of the vaccine, but for the multiple strains of the COVID-19 virus. And also the COVID-19 vaccine will not change your DNA. It will not affect your fertility. It will not cause miscarriages. And also the speculations that COVID-19 vaccine, if you get the COVID-19 vaccine, you will get injected with microchips or tracking devices. Those are all false informations. So what are the vaccines available now in the Philippines or in the different parts of the world? So in the Philippines, we mostly hear about the Sinovac, which is used now, and the AstraZeneca or the Oxford University AstraZeneca. AstraZeneca is published to have a 70% to 100% efficiency rate for asymptomatic COVID-19, or severe COVID-19 cases. And also we have the Pfizer-BioNTech. So this is used in the US and other parts of the world. And luckily we don't have it in the Philippines yet. It's still under negotiation. It is known to have 95% against symptomatic COVID-19 virus. And also we use the Sinovac. They say it's 65 to 91% efficiency rate. These vaccines are given in 2 doses. Pfizer and Sinovac is 21 days apart, while the AstraZeneca is given 4 to 12 weeks apart. So for the other vaccines that we don't have it yet in the Philippines, the Gamaleya, we heard about the Gamaleya Sputnik 5. They say it's soon to come for the Philippines, and also for the Novavax, Moderna, and the Janssen. The Janssen is only a single dose, but we don't have it yet in the Philippines. So learning what are the vaccines available in the Philippines today, who are eligible for the vaccine, who can get the vaccine. Basically, lahat po can get the vaccine. If we are in the peak of our health, wala po tayong sakit or any comorbidities, we can get the vaccines. Or even if we have allergies in food, allergies in insects, pollens, latex, other medicines not related to the COVID-19 vaccine, we can get the COVID-19 vaccination. If we have rhinitis or bronchial asthma, as talked about by Dr. Siao, still we can get the vaccine as long as we have maintenance medicines. However, if we have autoimmune diseases, immunodeficiencies, like autoimmune diseases, we need to be evaluated by our doctors. Consult your attending physician or allergologist. So autoimmune diseases, by the way, are those diseases that your own immune system attacks your own body. Meron po tayo mga sakit na gano'n. And those people who belong to those groups should be evaluated before they get the COVID-19 vaccine. Okay, but if you have allergic reactions to your first dose of COVID-19 vaccine, your second dose is definitely deferred. You have to be evaluated first by your doctor or by your allergologist. Okay, so next, who should not get the COVID-19 vaccine? So if, as I said, if you have immediate reaction on your first dose of COVID-19 vaccine, you will not get your second dose of COVID-19 vaccine. Other than that, even if you have comorbidities, actually on the A2 group or A3, people with comorbidities had been vaccinated with COVID-19 vaccine. That is why when we go to COVID-19 vaccine sites, we don't get directly injected with the COVID-19 vaccine. We follow steps wherein we register, examined by the doctors, your vital signs are taken, your temperature, your blood pressure, and many others, so that you will be evaluated prior to having the vaccine. So after we have the vaccine, what are the symptoms that we may get? So Dr. Siao described the symptoms that you possibly get from the COVID-19 vaccine. There are moderate, low risk persons, there are moderate risk and high risk. So for the symptoms or the allergic reaction, it is normal to have localized pain on your injection site or redness, or if you develop urticaria or pangangate or you have rashes, you are given anti-allergies. So if it will progress to a more severe reaction, like you develop difficulty of breathing, syncope, or you faint, nahimatay ka, or you have a drop in your BP, you are treated, should be treated in the hospital. That's why in the COVID-19 vaccination sites po, after you are given the injection, you stay for 30 minutes in the observation area to be observed, and doctors and nurses will monitor if you have certain reactions before they discharge you. Okay, and then what are other concerns regarding the COVID-19 vaccines? For the side effects of the COVID-19 vaccines, not all people will get a reaction or side effects. A lot of people will not get any reaction or side effects from the vaccine. So in Dr. Siao's presentation, he stated that there is more win in COVID-19 vaccine. This is very true because if we get the vaccine, we help ourselves from getting the infection, we help our families, we lessen the infection that is transmitted to our families, to our workers, to our neighborhood. So COVID-19 protects us from getting the vaccine, the COVID-19 infection. It will provide us additional protection on top of the safety and health protocols that we implement, like the hand washing, physical distancing, alcohol rub or sanitizing rub, or wearing your face mask and face shields. So let us also remember that COVID-19 is not a 100% protection. It is just an added protection for us to lessen the spread of the COVID-19 infection and to prevent us from getting the COVID-19 infection. And also, if we finally have the COVID-19 vaccine, it will protect us from getting COVID-19 infection. Thus, it will improve our quality of life. It will help the economy to go back to normal and our lives to go back to a more normal basis. So the benefits that we get from the COVID-19 vaccine is more than the risk that we may be thinking that we can get from the vaccine. So we hope that this webinar will help us and the public to soar up our confidence in getting the vaccine, not only for ourselves, but for the benefit of other people. Again, in behalf of the PWMSDC, we thank you all viewers for joining in this seminar. I hope that we learn from this seminar. Back to you, Ms. Isa.
Thank you, Ms. Mappy. And for our closing remarks, let us hear from Dr. Nini Lim, Executive Director of Medical Specialists and Diagnostic Center and the overall chairperson of this program.
Good afternoon, ladies and gentlemen. Today we have gained a better understanding of the challenge that the COVID-19 pandemic has brought us. The World Health Organization and the Interagency Task Force on the Management of Emerging Diseases have constantly reminded us to follow strictly the health protocols, such as the wearing of face masks and face shields, social or physical distancing, frequent hand washing, and others. These new health and safety standards have been established to ensure our safety and protection. But these measures are not enough. To further combat COVID-19, the WHO and the DOH have promoted vaccination, which experts say will continue to infect many. The COVID-19 vaccines produce protection against the disease as a result of developing an immune response to the SARS-CoV-2 virus. Developing immunity through vaccination means there is a reduced risk of developing the illness and its consequences. This webinar has filled us with plenty of ideas and information, statistical data, and corresponding interpretation. It might probably take some time for us to reflect on what we need to do to overcome this global challenge. But if this webinar has enhanced our individual understanding and appreciation of the benefits more than the risks of vaccination against COVID-19, then the webinar can truly be considered a success. I am sure we have been benefited from the sharing of our speakers. With the important insights and information shared in this webinar, we may now be able to make a decision. We do not have the luxury of time to wait for the best vaccine that will come. Apparently, the best vaccine is the one that is available now. The virus and its variants are spreading fast, and to have the vaccination is an important and urgent decision that we all have to make. Experts believe that by massive vaccination, we can develop herd immunity and prevent further surge in cases. And ultimately, hopefully, life will go back to normal. On this note, we wish to express our gratitude to our dynamic university president, Mr. Marco Alfredo Benitez, for his inspiration and invaluable support. To Dr. Felina Yang, Senior Vice President for Academic Affairs, for her encouragement and continued support. And of course, to our speakers, Dr. Winnie Siao and Dr. Aguedo Troy Gepte, whose knowledge and expertise have been invaluable and without any doubt have made this event a great success. I also would like to thank the working committees who tirelessly exerted efforts in making this event possible and successful. Most of all, we wish to express our thanks to you all for actively participating in the webinar. Since the COVID-19 pandemic has continued to affect our lives, we will look forward to seeing you again in our future webinars about COVID-19. Have a nice day, stay safe and healthy and protected from COVID-19. Thank you very much.
Thank you, Dr. Lim. On behalf of PWU, I would like to thank everyone for watching our first webinar entitled COVID-19 Vaccination, the Pros and Cons. We would like to take this opportunity to greet our university president, Mr. Marco Alfredo Benitez, a happy birthday. Happy birthday, Sir Marco. I would also like to extend my gratitude to the PWU Medical Specialists and Diagnostic Center and the working committees for making this program possible. Again, I am Isa Donna Togbo. Let us join together in singing the Philippine Women's University hymn. Thank you very much. Stay safe and God bless.